How do you get a swallowing assessment after stroke with limited resources? Imagine a stroke patient in a hospital with few specialized tools available. How can healthcare providers figure out if they can safely swallow food and liquids? The answer lies in simple, practical steps that focus on safety and early detection. First, bedside screening is the most accessible method. Trained nurses, doctors, or therapists can observe the patient while they swallow small amounts of water or other test substances. They look for signs like coughing, choking, voice changes, or difficulty swallowing. This quick check can be done immediately after admission or when the patient is stabilized. Its goal is to identify those at risk of swallowing problems early, so they don't accidentally inhale food or liquids into their lungs. If available, a more detailed clinical assessment can be performed by speech-language pathologists or trained professionals. They examine the patient's oral motor function, watch how they swallow different textures of food and liquids, and assess their airway protection. This helps determine what types of food and drink are safe and whether further intervention is needed. These assessments do not require expensive equipment and can be done in most hospital or rehab settings. Alongside swallowing evaluation, nutritionists or dietitians play a key role. They assess the patient's nutritional and hydration status and recommend appropriate food textures and fluid consistencies. For example, pureed foods or thickened liquids might be safer for someone with swallowing difficulties. When swallowing is unsafe, dietitians can also advise on enteral feeding options, like feeding tubes, to ensure the patient still receives proper nutrition. While advanced tests like videofluoroscopic swallow study or fiber optic endoscopic evaluation of swallowing provide detailed images of the swallowing process, they requiring specialized equipment and trained staff. In resource-limited settings, these are often not available. Instead, the focus remains on clinical evaluation and ongoing monitoring. Swallowing function can change during recovery, so regular reassessment is important. Repeating bedside screenings or clinical evaluations helps adapt care plans and prevent complications. Training healthcare workers in basic swallowing screening techniques and developing simple protocols can make a big difference. Using validated tools that are easy to implement ensures early detection and safer care without high costs. Summary: even with limited resources, early bedside screening by trained staff, clinical assessments by available professionals, nutritional management, and ongoing monitoring form the backbone of effective swallowing assessment after stroke. While advanced tests are ideal, they are not always necessary if proper clinical evaluation and vigilance are maintained. Always remember, consulting healthcare professionals for personalized advice is essential, as each patient's situation is unique.